rather, we should all be now seeing with seriousness. So we had our so-called EOC, Emergency Operation Center, and we are very fortunate now because even Secretary Roy Simato, the overseer, and no less than the chief implementer, General Feliciano, is now in the city of Cebu. And they've been doing too much concentration now in dealing with the surge, Sean.
All right. We have the Octa Research Group saying that Cebu could see up to 400 new daily cases if this trend continues. You were talking about remaining compliant, of course, to the basic health standards that we've all gotten used to, Vice Mayor. But are there any new protocols that you guys have put in place apart from the standard?
We are now getting, we should, at this point in time, looking back, when we were almost to reach a zero level last year, we were already been too compliant in terms of all these protocol requirements. And then came the Christmas and the season, especially towards New Year. It was a recognized fact that there have been some lowering of the guards. And now we have to go back, and we should not be reinventing, but rather get back to basic and back to our manual, because we already have this manual formulated no less than the group led by Secretary Roy Simato, particularly really with all the mental cracking by Chief Implementer General Feliciano. So if you're talking about additional, in fact, I've been very clear because I am instituting a couple of months on this movement called Citizens Protocol Enforcement Movement, where those who are a part have taken an oath to perform the function of protocol enforcement marshal, where emphasis should be about just a simple acronym, Wuhan. And what does Wuhan? Make it a way of life. Wash your hands. Use your face mask. Have your temperature checked. Avoid crowded places. Never touch your face. Men, mouth, eyes, nose. And in public places, Sean, always wear face masks and observe physical distancing. And I add up, I've been adding up now, emphasis, do not talk while eating. Because when you start removing your mask and then in a gathering anywhere, public or otherwise, then you start removing the mask, then the transmission can commence. And then definitely self-discipline and add up with our deep devotion with Senior Santo Niño. Prayer. Prayer is what we also is bringing everybody to be making it a way of life.
Very good advice on the whole, Vice Mayor. Definitely going back to basics. Again, stricter enforcement and stricter compliance with the basic or minimum health protocols. Now, I just wanted to ask us a last question before we let you go. Have you guys detected the UK variant there in Cebu? Are you guys sending samples for genome sequencing?
That should be part of the job of the Department of Health, where our emergency operation center been in constant and oneness is what we are practically adapting. We are now, unlike before when I was very clear on our position, when there was such a surge months ago, somewhere in March, where I have been emphatic that we cannot be handling this matter with many cooks, because many cooks was the fruit. Now with one leader, with us also being what we call sensitive, so the need to really look into, but rather, if you talk about variant, I have my position on the matter being the head of the Committee on Health and the chairman in the council on COVID-19. We should not wait until the variant being determined. We just have to assume. We have to assume that what we are now experiencing might be or might not be, but we have to act as one. We really have to act as one, Sean.
Yes, very sound advice again. Good luck to Cebu as well as to the rest of the country. Thank you so much for your time. Vice Mayor of Cebu City, Michael Rama, thanks for joining us today. And COVID-19 cases in the country have climbed to over 521,000. This as the Health Department reported around 1,800 new cases today. There are now 35,000 active cases in the country. Meanwhile, 48 more people died from the disease, pushing the death toll to 10,600. Meanwhile, total recoveries are at more than 475,700, as over 170 new survivors were logged in the last 24 hours. And the Philippine General Hospital is gearing up for the vaccination of its employees. The hospital director has also vowed to receive the first dose once available to boost vaccine confidence among the staff. Jenny Dongon joins us live from Manila for the details. Hi, Jenny. What's going on there in PGH?
Sean, UP Philippine General Hospital is working double time to prepare for the arrival of vaccines. PGH is among the 3 hospitals in Metro Manila expected to first receive the vaccine supply from the government. In today's visit, Health Secretary Francisco Duque lauded PGH role in the country's fight against COVID-19 pandemic. Hospital Director Gerardo Legaspi said they will take whatever vaccine brand that will be offered to them by the government. Based on a survey among the PGH staff, 72.6% or 1,300 hospital personnel are willing to be inoculated, while around 26.7% or 478 people answered not now. Despite this, Dr. Legaspi is confident that those who want to postpone getting vaccinated will change their minds once the jobs arrive. The PGH is also gearing up for the possible adverse effect of the vaccines. Sean, PGH Director Gerardo Legaspi said that he will be the first to receive the vaccine once available, just to boost confidence among their staff. And he's also said that this is on top of their efforts to educate their staff about the importance of inoculating medical frontliners first. Sean.
Right, thank you for giving us that update from the city of Manila. News 5's Jenny Dong. And the rest of the city government is going full steam ahead for its inoculation program. The Manila LGU has also drawn up a master list of priority vaccine recipients. JC Cosico with that story.
The city of Manila targets to vaccinate 1,000 individuals daily in each of its 18 inoculation centers as soon as COVID-19 shots arrive. Manila Mayor Isko Moreno says they could expand the number of their vaccination sites to 60, but not for now, as they are anticipating some hurdles.
Binakunahan nga natin nung una, saan mo siya hanapin sa pangalawa? Sayang naman, baka mamaya may lumabas ang guidelines na mapabaliwala yung una mong bakuna pag hindi sumama pag hindi ka nagpabakuna sa pangalawa. Kung yung produkto na yung brand na yon ay 2 doses.
Around 600,000 residents are included in the city's master list to receive the shots. These include frontline health workers, senior citizens, indigents, and uniformed personnel. 76,000 individuals have so far pre-registered in the LGU's website for the inoculation. Officials meanwhile inspected the city's cold storage facility at the Santa Ana Hospital. 700 to 800,000 doses of any vaccine type can be stored in the area. FDA Director General Eric Domingo underscored underscored the importance of these facilities to ensure effective vaccination. This, as he assured, vaccines issued with emergency use authorization are safe. So far, Pfizer and AstraZeneca have received EUAs from the FDA.
Hindi po ako magpapasa ng bakuna na hindi ko ituturok sa sarili kong mga magulang. Kaya po pag nakarating po dito sa inyo yon, wag po kayong mangamba. Inaral po talaga natin yon.
Domingo adds, Sinovac, Gamaleya, and Bharat Biotech's applications are still pending as they wait other reviews conducted by experts and Stage 3 clinical trial results. The FDA is still awaiting applications from Moderna, Johnson & Johnson, Clover, and Sinopharm. Manufacturers are also developing revisions if the vaccine's efficacy reduces amid the detection of new virus variants.
We're confident that the companies will be able to respond to the need. Pag nakitang bumababa na talaga yung efficacy, then i-revise yan para maka-respond siya doon sa prevailing virus at that time.
However, the country's FDA is not yet keen on granting an EUA for self-swab test kits. The FDA also reminded the public not to use non-registered FDA products to ensure safety. For News 5, JC Cosico, We Are One News.
Metro Manila will continue to be under General Community Quarantine or GCQ for 1 more month. Also under GCQ starting February 1 are the CAR or Cordillera Region, Batangas, Davao del Norte, Lanao del Sur, as well as the cities of Tacloban, Davao, and Iligan. Malacanang says that come next month, the rest of the country will be under Modified GCQ or MGCQ, the least restrictive quarantine status. Malacanang has announced new requirements for foreign travelers entering the country after the government decided not to extend the travel ban on countries with known cases of new COVID-19 variants. Palace spokesman Heidi Roque said that foreigners must have valid and existing visas at the time of entry, except for those qualified under the Balikbayan program. They should also have a pre-booked quarantine hotel or facility for a minimum of 7 nights. Foreign nationals must also undergo RT-PCR testing upon arrival and on the 6th day from the date of their arrival. Arrivals will also be subjected to the maximum capacity of inbound passengers at the ports of entry. Malacanang rejected Baguio City Mayor Benjamin Magalong's resignation as contact tracing czar following a controversial celebrity party held at Camp John Hay. Palace spokesman Heidi Roque says that Magalong continues to enjoy the trust and confidence of the National Task Force against COVID-19. Magalong drew flack for attending a party where guests violated quarantine protocols. For more updates, visit News 5, The Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Sean Yao. We are One News.